I am extremely excited to introduce our next speaker, Dr. Adam Resnick. He's the director for the Center of Data-Driven Discovery in Biomedicine at the Children's Hospital of Philadelphia, or CHOP. Dr. Resnick is here to tell us how his team uses the power of the cloud to enable precision medicine in pediatric healthcare. Please help me welcome Dr. Resnick to the stage.
So I'm thrilled to be here today on behalf of CHOP, the Children's Hospital of Philadelphia, but also the more than 100 other institutions and partners, more than several thousands of patients and families who have come together to contribute to a common vision that I'd like to share with you today. Many of us will experience cancer in one form or another in our lifetime, either in friends or families as we age. Fortunately, only a few of us will experience cancer in the context of childhood. Childhood cancer is considered a rare disease context, but unfortunately, for far too many, it is a reality of their life. As a result, brain tumors are actually the leading cause of disease-related deaths in children, with more than 4,000 children diagnosed yearly in the United States, and even more across the globe. This context of a rare disease setting that is so pervasive and still is challenging on behalf of patients and their families has always created new opportunities to complement those challenges in creative and innovative ways. As a result, we've made progress over the years, but still today, most patients who are diagnosed with a pediatric brain tumor end up doing so in the context of a rare disease setting which has no off-the-shelf therapeutic intervention, meaning that there isn't a solution that a clinician or a doctor can say, I know you have this, and I can give you this, and it'll be okay. That context for families and patients creates a dynamic that is completely different than almost any other kind of healthcare setting. It challenges the modalities and the use of data, how it's used, what patients and their families are willing to do with that data, and how it gets empowered. And in many ways that we were surprised when we first embarked on that effort, it challenges the way healthcare itself functions. This is David. David was diagnosed with one type of brain tumor called glioblastoma. At the time, he was a young teen, curious, engaged, caring, inherently committed to working and partnering with others. When David was diagnosed with glioblastoma, a fatal disease, he and his family committed to participating in trials, in sharing their data, and in trying to change the status quo for healthcare. In doing so, they came to us at CHOP and engaged and asked and mandated that we partner with them on behalf of changing that landscape. David's mother is here in the audience, Amanda, and she essentially intentionally asked, how do we do this better? How do we connect across all the Davids? How do we empower data in new and empowered ways? She and many others recognize that no single institution, no single investigator, no single clinician can know that answer. And at CHOP, we began to partner with patients and their families to establish a network that initially began with 4 institutions and today spans more than 35 institutions that are committed on behalf of patients and with patients to share and empower data universally. In doing so, we launched in 2016 a Brain Tumor Atlas initiative, and it was the very first cloud-enabled data sets for pediatric cancer at the time. That initiative, 2 years later, got a huge boost from another patient family. This is Gabriella Miller. Gabriella, in ways that only a 10-year-old can probably do, challenged Congress to stop talking and start doing in ways that laid a foundation for the Gabriella Miller Kids First initiative. This initiative took what we had built for pediatric brain tumors across these 35 institutions and scaled it 100x. So now this initiative spanned not just pediatric brain tumors, but all cancers and rare disease context. This essentially led to dramatic expansion of cloud-enabled data sets that went from an initial $1.5 million petabyte to 10 petabytes that now expanded across the globe and is continuing to grow. That rapid scaling of data that went from only a few hundred patients to more than 5,000 participants affected by brain tumors is paired now with other data sets across the disease landscape with more than 26 billion occurrences or points of data to interrogate and more than 250 million genomic variants that can inform the understanding of the biology of cancer in these children. In part, this is because precision medicine is paramount in the pediatric context. We need to develop drugs that target the tumor, not the patient, right? You have rapidly dividing cells in the tumor, but the children themselves are rapidly dividing beings. So we have to drive precision medicine approaches that are data-driven and can be empowered. Historically, that's been a challenge in the rare disease context in ways that created barriers for pharma to even engage those efforts. We are thrilled to announce that over this past year, Day One, AstraZeneca, and others along the way are now partnering with this new data-driven architecture to deploy new clinical trials in ways that change how clinical trials can be run and affect the lives of children. Proof that this type of approach, where you empower patients' data's connectivity, where you can actually partner with their patients and families to empower their data in ways that typically are prohibited or challenged in a healthcare context, proof that that can change the way we actually see cancer in children in ways that looked unexpected, even happened in the context of David and Gabriella. Despite the fact that they were diagnosed with two different diseases, glioblastoma and DIPG, or diffuse intrinsic pontine glioma, despite the fact that they were diagnosed only a year apart, it turns out that through this multimodal data enablement in the cloud, we can actually now understand they actually have the same disease. They actually have the same mutation. And it's only through that multimodal integration and cloud-enabled resources that link data sets across patients, across communities, in as rapid a way as possible that we can drive that innovation. That foundational enablement of data in the cloud historically occurred as time-bound data sets. For us, we've been extremely excited to advance this to the use of Amazon Health Lake and shifting into a mode of real-time data flows from hospital system electronic health records in ways that now enable discovery in a dramatically new way. This is now coupled with what you've heard a lot about at this conference, the capacity to empower this large-scale data sets in real time on behalf of driving new interpretation and use of that data by our community, not just on behalf of discovery, but on behalf of care. And for us, that's the real goal, is to take these large-scale resources, but pair them with the streams of data on behalf of individual patients that can drive data analytics, visualization, insight, and discovery. That should happen for every patient diagnosed with a brain tumor, and we're delighted to announce that in collaboration with AWS, we'll drive a new initiative called David, as Amanda, David's mom, has approved. In true alignment with David and Amanda's vision, David will be a generative AI-empowered navigator that can drive real-time questions and answers on behalf of clinicians, researchers. It'll allow patients and their clinicians to ask the question, which trial can I enroll at this point in time? It still surprises me that very few clinicians can answer the following question. Show me all other patients in my institutions that had this disease with this mutation. What treatments did they get? What were their outcomes? Even that simple question in real time is a barrier to entry. David will take the first step towards helping to solve that. Let me end. Oh, yeah, please. Let me end by just saying this, that I've spoken about pediatric cancer or the rare disease context, but it turns out that the space of innovation we're harnessing is on behalf of what is much more generalizable. It turns out that being rare is not so rare. We're all individually different. We're we're all going to need to benefit from precision medicine approaches. For us, we seek to partner, collaborate, and innovate in this context in ways that's aligned with our community, in ways that's aligned with Amanda, Ellen, and the other families who are mandating data empowerment on behalf of real-time change. So thanks so much for your attention, and thanks so much for AWS and our partnership.